All right, next up, we are going to be spending a few moments talking with Dr. Christina Parkhurst, and Dr. Parkhurst is with CHI Memorial Surgical. Dr. Parkhurst, good to see you.
You too.
All right, tell me exactly what your specialty is.
I am a
Random gravity check on the pen, by the way.
I am a general surgeon. I do a lot of hernia surgery, and that's
Right.
what we're talking about today.
What kind of hernia specifically?
We do all kinds of hernia surgeries. We do ventral hernias or abdominal wall hernias. We do sports hernias, which are called inguinal hernias. And we do other hernias that are inside the abdomen, but that's not really what we're dealing with at this upcoming screening.
Tell me about the screening itself. Who came up with the idea of having a public screening and a free one at that?
So CHI Memorial, we have a general surgery group. There's 6 surgeons, and we decided to have this open to the public. It's free. Anyone can come in. They can learn all they want to learn about hernias. We'll be discussing them, and then we'll have the free screening for anybody that wants to get screened, anyone that has any concerns at all.
What's involved in the screening itself?
So we'll take you behind a curtain into a private area.
Right.
If you do have a concern for a sports hernia or an inguinal hernia, then we do an exam in that region. And then we also examine the abdomen as well to check for any hernias there.
What's the best way to stay on top of this to make sure that you don't have one? And I would assume that self-examination is a big part of this,
So
right?
sometimes you can have an inguinal hernia or a groin hernia and not know that you have it. And so it's very important that you go to your primary doctor. Most primary doctors will check on a regular basis, especially males, to see if they have hernias, especially as you get older. And then you can notice a bulge on your abdomen, usually around the belly button is where you'll get a hernia if you haven't had surgery before. But if you've had surgery anywhere that there's been an incision, you can have a hernia there as well.
Tell me what the surgical technique is for repairing, let's say, inguinal hernia. That's the one up here, right?
No, the inguinal is down in the groin. Those are
Okay.
the sports hernias.
What's the basic surgical procedure for this?
So the traditional procedure, and some surgeons do still use this, and we do use it for some patients, is to do an open procedure where we actually cut the skin, the length of the hernia, go in, and we actually can place mesh in that area to keep the hernia from coming back. Now we're doing more of a robotic approach. Most of us are doing the robotic approach because it's less invasive for the patient. The patients can get back to their normal activities much quicker.
The recovery time, and I've had them both, the recovery time for the latter method, it seemed to be almost instantaneous.
Yeah, some patients have instant relief. They're back to normal activities within 2 to 3 days. Not the real strenuous activities,
Sure.
but they can get back to work and normal activities usually within a few weeks.
What about the mesh that you use in the open technique? I mean, you see a lot of advertisements about if you've had mesh hernia repair surgery involving this, and I'm sure you guys are way ahead of the curve on this.
Yeah, so mesh has come a long way. Mesh used to be more of a plastic material that was hard, and sometimes the body would reject that.
Right.
Patients were prone to getting infections in that mesh. The mesh is more like a fabric now, and that's what I tell patients. It is, most of it is synthetic, but it's more like a fabric, and the body incorporates it much easier. It's much softer. If you have to have surgery again in the future, it's much easier for surgeons to cut through that mesh like it's your own fascia. So the body actually incorporates it and makes it like part of you.
I have heard that when the body does reject that mesh, the patient knows it in a hurry. It's not pleasant.
Most of the time, the patients will know, and we do have to go in and remove it. Again, that's a very small percentage. Yeah,
though.
less than 1% in most cases.
What do you find the average recovery time is if you do have to do the more invasive procedure?
If you have to do a big procedure, I usually tell patients about 4 to 6 weeks before they get back to themselves again.
Right, and the best way to get over the post-surgical pain is?
First of all, rest and relax for the first couple of weeks so that you don't overextend yourself. We do offer some narcotic pain medicines and NSAIDs and things like that for pain, but it's really important just to follow your doctor's instructions and not do too much.
And avoid heavy lifting.
Exactly.
All right, now the screening itself is coming up next Tuesday,
Yes.
correct? From 4:30 until 6:30.
Correct.
Tell me where it's going to be.
It's going to be in the community rooms at CHI Memorial downtown. The community rooms are very easy to find. There's convenient parking and everything. Like we said, there's going to be 6 surgeons there, and we'll do the free screenings for anybody that wants to be screened.
Great public service, as always, from CHI Memorial. Do them a favor, and do the other folks showing up a favor. Make your reservations. They are preferred, but not required. Call them at 495-7877. Again, 495-7877. Stick around. We have more Let's Chat right around the corner.